objection, you may proceed.
Yes, I ask for permission to address the body for 5 minutes with unanimous consent.
The gentleman is recognized for 5 minutes.
Thank you, Madam Speaker. Madam Speaker, today I rise to call upon this Congress to assist states facing overwhelming shortfalls in funding their state health insurance program. In 1997, Congress created the SHIP programs to help states provide health care coverage to the growing number of uninsured children throughout the United States. 10 years later, more than 6 million children have been enrolled in this program. They are going for annual checkups to the doctor, and they are getting their prescription medications that they need, and they are also receiving care when they are extremely sick. Unfortunately, Madam Chair, this program's success is threatened by inadequate funding, and hundreds of thousands of these children stand to lose this health care coverage they have grown to rely upon. Federal funding has failed to keep up with the program's expanding enrollment, and inefficient allocation of these funds means some states are sitting on more than $1 billion of SHIP funding, while 14 states, including my own state of Georgia, face severe shortfalls on the order of hundreds of millions of dollars. This inadequate funding has forced some states to consider stopping all SHIP medical services. Without help from the Congress will be unable to continue to provide health care for the 300,000 children enrolled in its PeachCare SHIP program. Without increased federal funding, these children will no longer receive their immunizations. They will no longer get their teeth cleaned or their eyesight checked. And worse still, they will not be able to afford emergency room care in the event of a tragedy. Madam Speaker, terminating coverage for these children would lead this country further away from decreasing the number of uninsured children in the United States. Congress must act expediently to allocate federal funding to those states facing SHIP shortfalls. It must reauthorize the program to ensure that all 6 million enrolled children continue to receive health care. And it must increase federal funding so that more uninsured children can be enrolled in this program and get the health care that they deserve. I look forward to working with my colleagues from Georgia and other affected states to rectify this increasingly dire situation. I yield back.
Mr. Poe of Texas for 5 minutes.